Hello. It's so great to be with
Hey,
you,
Terry,
Dr. Manan.
all across the country there.
Yeah. Hello, everyone. We're so excited to be here with you today to talk about menopause and talk about empowerment and give you awesome tools for your menopause toolkit. And whether you're joining live or watching a recording, welcome. And if you're joining live, you can always use that chat box and let us know where you're joining from and ask any questions, leave any comments. And if you're watching a recording, also please do the same, comment on the video that you're watching, get in touch with us via any of our social channels. We'll tell you how to subscribe and how to find us on our websites.
And how to get our
So
special offers.
yes,
Yeah.
definitely. Definitely. Our special offers will be presented during this time together, and you can find out more by visiting our websites and subscribing on YouTube.
All right. So we want you to understand that what we're going to be talking about today is very profound, but it is an introduction. And a lot of the techniques and things that we're going to teach you today can be applied and help empower you in many ways. And it's just like the beginning of that process. So I hope that you can be in a comfortable place where you're in a quiet area where you can really focus on what we're doing today, because we're going to be doing a couple of exercises so that you really get a feel for these practices that we both do, and that you can give it your fullest attention. Okay. You might even want to have a pencil and paper if you want to write something down. All right. Go ahead, Terry.
Awesome. Wonderful. So we'll do some introductions before we dive in, and then we'll dive right into those secrets that are invaluable for managing your menopause experience. So Dr. Manan is a holistic practitioner who recently left office practice after 30 years and is now completely dedicated to helping women overcome suffering, create holistic wellness in their lives, and reverse their age at the same time. She will tell more of her story in a minute.
All right. And Terry Lynn has a mission to empower women to gain more control over their health. And she's passionate about using movement to create better well being by enhancing awareness, alignment, and healing. One of her specialties is the area of pelvic health, which is what we're going to be exploring today. And she will also tell more of her story and how she got involved in this practice in just a minute. So, right now we're going to start exploring the sacral chakra and how to empower your sacral chakra for overall wellness. So this is Dr. Manon Fielding and Terry Heath, as we said, and we're going to get started. So when I was going through menopause, I had, like you, started developing symptoms that made me feel a little bit not like me, right? Both emotional as well as physical. So, emotionally and mentally, one of the things that I was going through is I had really severe anxiety to the point of having several panic attacks. And they were so extreme and so unusual for me. Let me give you an example. I was trying to go to a professional meeting, and right before I was going to walk into this meeting, and I wasn't presenting, I was just going to be sitting there, I just all of a sudden had a panic attack and I couldn't go in. So, that's pretty extreme. The other things, my migraines got really severe. I had a loss of libido. So that one is very connected to the sacral chakra, which we're going to talk about in just a minute. All of those things compound to make you feel like less than, that you're not feeling like yourself, but you're feeling less than yourself. So what we're going to do today is tell you how to get back that energy. And really, what, like Terry was saying earlier, it's an empowerment, and these are tools that you will be able to use forever. And some of these tools you can use for any energy center, which I'm going to explain in just a minute. So let me get started on, so you understand a little bit more about what I'm saying. Okay, so I like to envision menopause as a period of time of transformation. And when we come out of it, we can be like butterflies and feel lighter and feel more empowered and feel more in control of our physical and emotional health. Because during menopause, the ovaries stop producing estrogen, and the changes in hormones and in that physical also have profound effects on all areas of our body and mind. Not only that, it's also a time when there's a lot of transitions where things are changing in our family. Your children may be grown and moving out. If you're in a marriage relationship, that often there's a lot of changes happening with that. Your husband or significant other is having their own experience with midlife, and you're having yours. So there's just a lot of changes that are happening. And when you're going through all of this transformation, it can affect you at work, it can affect your friendships. And that's what I mean by this distortion. The other thing that I want to bring up, because I have heard from a lot of women in menopause that old traumas often resurface during this time. And if it happened to be some kind of sexual trauma, that's even a greater effect, because the sacral area has so much connection to our sexual function and to our desire and libido. So that is how that works there. All right, so let's just explain a little bit about what chakras are. When I first heard the word, it seems very mysterious and Eastern, and they don't really relate to me, but they're really just energy centers. And the sacral chakra is the one that we're talking about that gets distorted, especially in midlife. There's a few of them that are more prominent in midlife, but today we're focusing on that. And it gets blocked. So you can think of a distortion as a blockage where the energy of negative experiences or feelings can be stored in that area, and it starts to cause a disconnect between your mind and your sacral area. There are different physical and emotional symptoms that occur, and I'm going to explain that in just a minute. And then these practices help you to remove the blockages and restore our connection, mind, body, spirit, and you start feeling more well. It improves your physical and mental health in a very real sense. So one of the things when I was in school, we learned that there was energy and there was matter. And they were two completely different things. There was already the understanding of E equals MC squared, but I don't think anybody really knew exactly what that meant. And basically, it's saying that we are all energy, and essentially stating that this is Albert Einstein, a small amount of mass can be converted into a large amount of energy. So we actually are a powerhouse of energy. And I know sometimes in menopause, we don't exactly feel that. We might be very depleted, really, because of all the stuff that I was talking about. But we have the capacity to unleash that energy. It's always there. And that's what we're going to work on. And so the first step is awareness. So just understanding this and knowing that it's possible is really just the very first. So I talked about how the energy comes into your body from the top down and out. And you can see how these lines get fainter and fainter as they go away from the body. When they get closer to the body, they become denser near where we are. And that's what a lot of people would consider your aura, that denser area around your body. And it's affected by our thoughts and our perceptions, especially our judgments. So they're finding now that thought energy can actually change the internal being as well as the external being. When you have judgments, especially against yourself, let's say you're not feeling very good physically, you're feeling like you've gained some weight, which is probably one of the biggest complaints in menopause that I hear of. And things that are visible to others just make you feel not as good and secure about yourself. when you have those feelings, you are actually creating those blockages in your body, that negative energy. And that's what distorts our energy center. So we're going to talk about how we can let those go. And a lot of what I teach and work on, even though I do a lot of work with the physical, it's really learning how to change those negative thought patterns so that we can release that energy. All right. So I did talk a little bit about how our judgments distort our energy. So I'm not going to review this one again, but these are the different energy centers, just so you are aware of where they are and what I'm talking about when I say energy centers. So you have your crown chakra here, then your brow is your third eye. You have your throat chakra here, your heart chakra, which we are going to talk a little bit about also, because that one is also very important in healing all the rest of them. You have your solar plexus, which is right where your ribs and your abdomen hit here. So I'm going to stand up so you can see. And then the sacral chakra is right down in the lower part of your abdomen below your belly button. So when I ask you to put your hand there, when we do the exercise, you'll know where it is. And the root chakra is all the way down at the bottom in our pelvic floor, at the very bottom of that floor. So those are the 7 energy centers or chakras. Now, I did mention that there are different ways that they can become blocked, and I want to go into that a little bit more here. So these are some of the reasons that they can be blocked. So you have lifestyle. So what kind of things can cause that? Poor posture. So if you're sitting slumped at the computer all day or working on your phone, unhealthy diet can block. Lack of physical activity, you're not moving enough, just generally just movement. And that's one thing Terry's going to talk a lot about today. All of those kind of lifestyle things can affect the chakras. Then stress. We all know that stress can play a positive role, but also can be the chronic stress, and the way that we perceive it can cause a lot of difficulties and blockages in these chakras, physical and emotional stress. So physical stress too, like we were saying with lifestyle, if you're in pain, that's a physical stress. It's a physical and emotional stress. Okay, negative thoughts. I did mention that. Negative thoughts play a role. Trauma. It doesn't even have to be I'm not talking about like you're involved in a war zone, which it could be, but it could be any kind of trauma or experience that you integrated it and held in your body. I'll just tell you briefly when I was like 10, 11 years old, I was playing softball, and I had someone threw a ball right into my abdomen, right into my sacral chakra, in other words, and it took the wind out of me, and I fell over. And I didn't even remember this until years later when we started talking about these energy centers, and that's a trauma. Okay, you also have fight or flight mode, your sympathetic nervous system. So if you don't know how to calm down your nervous system, that's one thing we're going to do today, then you're constantly in what they call the fight or flight mode, and that can cause blockage of your chakras. Okay, now I did mention that all the chakras are connected to different emotional states. And with the sacral chakra, 2 of the things that are very important are passion and creativity. And so a lot of people notice a change in those feelings during menopause. And I did mention that it's where it's located, that it's in the lower abdomen right here. And some people consider that a very like Kundalini energy, which just means really powerful energy, like a coiled snake ready to go. And you know how I was just talking about how mass can be explosive energy. This is an example here of that Kundalini. So how do we unleash that so that we actually feel that energy? So many women that are going through menopause are blocked in those areas. And what they have a word for it when you're disconnected from your emotions, when your parts of your body and mind are separated from each other. It's called anhedonia. And I have heard a lot of women talk about this where they just don't care about anything. They want to feel things and they know that they're lacking that, but they don't really understand why. This is really one of the reasons, and the techniques that we're going to talk today will help to unblock that. And the reason I put this picture here is when we do the exercises and you do yoga or you do any of the exercises that we're talking about, it's important to push out thoughts as much as possible of other things, to not have your phone near you, to not be thinking of your emails, to focus on what you're doing at that moment. So you've heard this called mindfulness. That's part of the process, is being more mindful. And that connection, mind, body, in mindfulness actually is tremendously healing, a lot more than anybody ever even considered before. So these are different things, different techniques. So when you see here, it says backside symptoms, front side symptoms. What that means is like, it's two sides of a coin. On one side is all what you might consider the positive parts of that chakra, the things that are positive. The backside of the coin is all those things that are the challenges of that chakra. Let's go to the backside first. So we talked about sex drive. So you have an unbalanced or limited sex drive. You might feel emotionally unstable, have feelings of isolation, like I just mentioned, impotence, frigidity. Physically, you might experience bladder issues, which specifically what we're talking about is like having increase in urinary tract infections or having incontinence. So those are very important parts of having an unbalanced chakra, or even low back pain, because that's part of right in that lower back is the other side, right? So the positive aspects of the chakra, you have like an inner knowing, you trust yourself and your feelings, you are able to express them, you're very attuned to your feelings, your creative energy is flowing. And creativity doesn't have to mean that you're an artist or a writer or anything like that. It could be creativity in any aspect of your life. So we're going to go into some breath work and different things that you can do to open that up. And I did want to point out here, which I'm not going to do any examples of this here, but I wanted to point out you have the boat pose and the pigeon pose, the bicycle, the spinal twist. All of those are yoga poses that can actually help with the functioning in the sacral chakra area. And any of these things, I actually have a printout of all the yoga postures. If that's something that you would be interested in, to please let me know when you contact us. All right, so now we're going to do a little experiment, and we're going to do this together as an experience to start releasing some of that sacral chakra. I'm going to do an exercise, and then Terry Lynn is going to actually do another one that will help strengthen and improve your connection with your pelvic floor in a very positive physical way that works amazingly for some of these situations that we're talking about. And you can combine these practices together. They're going to be very powerful to do it in one sitting. So I showed you where your sacral chakra is. So I want you to put one hand on the sacral chakra. Okay, I'm sorry, before we do that, I want to take a look at these mantras, because I want you to pick one that is most meaningful to you. So let me bring that up. Okay. I value and respect my body. The second one is I take care of my body. The third is I am passionate. So if you're trying to release more passion in your life because you're not feeling a lot, I allow myself to experience pleasure. That allowing yourself to do that is part of the sacral chakra. I embrace my sexuality, and I enjoy expressing my creativity. So, whichever one speaks the most to you right now, I want you to write that down. It's going to be one of the mantras that you're going to say to yourself while we practice this belly breath. So, you're going to put one hand on your chest around your heart area and one hand, it doesn't matter which one, on your sacral chakra. And before we start the breathing, I want you to also think about someone or a pet or something that you love that brings out a feeling of love. Whenever I do this, I always think of my dog and my daughter are the two things that stimulate the most feeling of love in my life. Whatever that is for you, I want you to have that in your mind. And what I want you to do is start breathing through your heart. So take a deep breath and slowly breathe through your heart. You feel the energy coming through your heart in, and then breathe out, out through your heart, all the way out, and then push your belly in towards your spine. Let all the air out. Breathe in through your heart. And breathe out through your heart, slowing down your breath even more each time. Push your belly in towards your spine. Feel all your body relax as you breathe out. Breathe in through your heart. Breathe out. Now, on your next breath, as you breathe in, I want you to feel that love energy spreading throughout your body, especially filling up your sacral chakra, your whole pelvic floor. Breathe in, love. Breathe out through your heart. Fill that lower chakra, that sacral chakra, fill it with that feeling of love for whatever person, pet, place. Breathe in through your heart. Fill your body with that love feeling, especially in the sacral chakra. And breathe out. Breathe in. Feel that love feeling throughout your body, especially throughout your sacral chakra. And hold it. Fill it up. And as you breathe out, spread that love out as far as you can outside your body. Feel it. That white, bright light of love spreading throughout the area around your body. One more time. Breathe in through your heart. The love is filling your body. Fill up that sacral chakra, fill it up, and breathe out. Let it spread throughout your body and all around the outside of your body. Okay. Good job. Good job. So, the reason we use the heart chakra and that love, excuse me, is because love energy is called the universal solvent, and it can dissolve any negativity in your body and mind and clear it out, anything. And that's what I think all religions teach that we don't practice enough, but we can do that practice for ourselves and clear that out. All right. Excellent job. All right. So today I want to offer anyone who has watched this today and they're interested in learning more about how to use these mind, body, spirit techniques. I do a blend of science and spirituality. I do a lot of scientific testing, state of the art testing, actually, and incorporate it into these energy practices so that they become much more powerful. And I'm offering $200 off of either program. When you make your consultation appointment, you use the code VIP 200. I'm going to put all this information in the description so that you can click the link to schedule your appointment and use that code. The two programs are Holistic Strategies for Eternal Youth, and it goes through the entire framework of our body and mind. And I do a genetic test that looks at 134 different genes that is very comprehensive in terms of health and healing. And we start a program correcting all of the imbalances that we find and a foundational support for your long and healthy life. The Targeted Solutions program is more geared towards symptoms and solutions to particular problems. If you're having a difficult time with weight management or anxiety or depression or real specific symptoms and you want to just deal with that right now, then that would be the program for you. Well, I enjoyed that part with you today, and I'm going to turn it over to Terry Lynn to give you some amazing pelvic health work today.
Thank you, Dr. Manon. That was so valuable. I really enjoyed that breathing exercise, and it calms me down so much. And I could even hear it in your voice, how you were calming yourself. It's so powerful. And
Yeah.
I love how you did address this, and I was going to ask this question about how you said that the heart chakra is always involved in the healing process. And I think you answered my question with that, is we're breathing through the heart because it seems as though we need that clear energy flow throughout our chakras to really optimize all the benefits.
So we can use that heart chakra to clear any one of them that we're having problems with. I use that for any of them.
Awesome. Thank you again, Dr. Manon. That was super valuable. So I'd like to take a minute and introduce myself before I dive in to tell you a little bit more about my programming and then really get into the secrets to pelvic floor health and strengthening. So I've been in fitness my whole life, but I had the opportunity a couple of years ago to really go all in. And I chose to dive into mobility and strength training because I learned that the information coming from our joints is so impactful and it goes directly to the brain, bypassing the other filters of other movements in our body. So that proved to me that joint strength was of the optimal importance. So joint strength led me to menopause because lo and behold, I was experiencing perimenopause symptoms and I didn't even know it. So the more I learned about joint strength and menopause together, the more I knew that this was my path and this was my passion. And I became so intrigued by the power that we have over our health through movement. And I've lost a lot of women in my life, too many women in their 50s and 60s. So it is my mission to stay here as long as I can with the people that I love and helping to bring women along with me along that journey by educating and working with folks to really help to raise awareness about our health and how we have the power and the dominion over our health if we so choose, and to help people understand how they can advocate for themselves for a better future. So I'm excited to dive in and tell you about my offer that I have for you. So I offer a 12-week program that is an intensive called Optimize Pause. That is designed for women who are navigating perimenopause or menopause. And it is a 12-week fitness and nutrition and pelvic floor strengthening opportunity. We have live office hours weekly. We have modules that support advocacy and mindset shifts. So many practices are revealed and shared, including lymphatic drainage and self-care practice. We have modules to support nutrition and symptom tracking and how to prepare for your health care appointment and advocate for yourself in perimenopause or menopause. And midlife really doesn't have to be a crisis. I know that we face a lot, and there are so many symptoms that come up, and we can feel lost and we can feel alone. But really, we do have the support, like from people like us, like Dr. Manan and I. We're here to help you navigate this tremendous transition that we all go through. So you can optimize your menopause experience by joining Optimize Your Pause. I keep it a really small group, between 5 and 7 women each month. We start monthly. And as I said, it's fitness programming and office hours weekly. There's live coaching and one-on-one as well as group coaching. So you can really realize that community with other women who are going through a similar experience. We all have our own very unique experience of menopause, and it's nice to all come around and sit around a table, a virtual table, and chat and support one another. It's so valuable. That community is super valuable during this time. So I'd like to offer anyone who's watching this live or anyone who's watching a recording to reach out and visit www.themovementpath.com to enjoy your $300 discount. So for 3 months, it's currently $12.97, and anyone watching this video and recording will enjoy a $300 discount. Awesome. Thank you. Wonderful. And you can always subscribe at Terry Lynn Heath on YouTube and other social channels, and visit themovementpath.com to book a free consultation, and just email me there or direct message me on any other social channel. Okay. So as we talked about, by the end of the time, by the end of this presentation, you will be empowered to take immediate action to reduce your pelvic menopausal symptoms and reclaim your future. Wouldn't it be awesome to fall in love with your future rather than living in agony and pain? So we want you to be empowered by the time you leave us today to really reclaim your future and take charge. We'll provide the tools that you need to optimize your pelvic health and to really take charge of your menopause symptoms. So you are in the right place if any of these sound familiar. This list of pain points and pelvic symptoms that come along with midlife and menopause are real and debilitating. They affect our quality of life, and they are serious and scary. The reoccurring UTIs, painful intercourse, low libido, lack of bladder and bowel control, otherwise known as incontinence, lower back pain, pelvic organ prolapse, low confidence, a dry vagina, terrible symptoms that we can impact through movement and pelvic floor strengthening. And of course, we're looking for a quick fix. We don't want anything to do with any of those symptoms. We want to end the pain and suffering as quickly as possible. Women I talk to want an overnight solution, and I don't blame them. I have a client who came to me and who was feeling protruding in her vagina, otherwise known as prolapse, and had gotten that diagnosis where her tissues had thinned and her bladder was beginning to shift downward. Surgery was recommended, and she wanted to see if she could avoid it. She wanted to see results fast, however. She gave me 6 weeks to see some change. We began working together, implementing pelvic floor strengthening and lifestyle shifts. And 6 weeks later, when she returned for her follow-up, her doctor was amazed by the changes she felt in her pelvis, and she was able to avoid surgery. I love that story. It's one of my proudest moments. And today she feels stronger than ever before. So we can really avoid the surgeries if we just give our bodies a chance to engage in that self-healing. But we need those tools, so that's why we're here. So I'd love to show you today how you can take control of your pelvis and your future. So let's take a look at what pelvic health means. I love this definition of pelvic health from the Baylor College of Medicine. Our pelvic health is considered paramount to our overall health since it houses so many organs and performs so many functions, including sitting, walking, running, creating, and birthing life, to name but a few. It is in our best interest to have our pelvis and pelvic floor in its optimal condition. Simply put, your pelvic health contributes to your overall health. What and why is this important? Optimal pelvic function helps to enhance sexual pleasure, prevent bladder failure, increase bowel control, prevent pelvic organ prolapse, regain confidence, and improve your orgasms. I had a client who came to me and she was no longer able to realize orgasms, to experience orgasms. And she had a healthy sex life her whole life and a great relationship with her partner. And all of a sudden, she was unable to experience that pleasure that we all enjoy, or most of us can enjoy. And she was able to regain her orgasms after 3 weeks, just 3 weeks of pelvic floor strengthening. And so I love helping women to regain their confidence and step back into their bodies. And that's what we'll do today. First, I wanted to say or show how we are up against a lot in perimenopause and menopause. And the journey is, like I said, very unique for each and every one of us. Some of the risks of hormone decline on the pelvis. Thinning tissues lead to pain and sensitivity in the pelvis and vagina during intercourse. So by implement exercises and techniques and breathing techniques and exercises that engage the pelvic floor, we can bring more blood to that area and bring tone and strength to the pelvic region. Women who experience this genitourinary syndrome of menopause can experience a variety of symptoms. This is a progressive set of conditions. So progressive meaning it just kind of gets worse as we age if we don't address these symptoms. They can include sexual and urinary symptoms like genital burning, discharge, urinary dysfunction like bladder and bowel control, urinary urgency, recurring UTIs that can often go undiagnosed and present, as we see this in women as we age, and we often miss those reoccurring UTIs and instead get some sort of cognitive impairment. So 84% of postmenopausal women are affected by these progressive symptoms. This is also something that we can affect through movement and strengthening of the pelvic floor by bringing more blood and strength to that region. Here's a little diagram of where the pelvic floor lives in relationship to your other organs. So here, the red strip there are 3 layers of pelvic floor muscles, and pelvic organ prolapse is where all of those or some of those organs shift downward and protrude and press into the vagina. And as our tissues thin, our pelvic floor also thins, and the strength in our pelvic floor declines. So we can really implement strength training techniques that train the pelvic floor just as we would implement any other technique to strengthen our bicep or our quads or our hamstrings. We can employ the same types of techniques. We just need to know how to access that pelvic floor. Like, how do you even get there? So that's what I'll show you today as step 1 to strengthening your pelvic floor. Other risks of hormone decline on the pelvis: loss of bladder and bowel control. That can be very embarrassing. Difficulties emptying the bladder and bowel can be stressful and lead to poor health. One of the things I'll talk about as we practice this exercise is that it's just as important to relax the pelvic floor as it is to contract it. So a difficulty that we see when we hold our bladders for too long because we just can't go to the bathroom, that constant contraction makes it more difficult for us to actually relax it. So we really need the relax and we need the strengthen in order to tone the pelvic floor. reoccurring UTIs, as we talked about, can be dangerous and go untreated. So just a few of those symptoms that we experience during menopause that make it really difficult to live a quality life, because they can be stressful, as I said, embarrassing, and have to deal with it. We don't have to take it. We can take steps to implement strength and empower ourselves to heal our bodies. There is high quality research showing that pelvic floor strengthening may help reduce the risk of incontinence, as well as reduce the severity of pelvic floor symptoms like painful intercourse. So we are getting more research devoted to women's health, thanks to our First Lady currently. So there is a lot more research, a lot more energy around research. And we, as women, we know that it wasn't mandatory that we were included in research until 1993. And so we have a long way to go, and we've just begun. And it's an exciting time to be in women's health and to be in our bodies, because we do, more attention is being shed on women's health. And that's why I'm here, and that's why I'm empowered and excited to share these things with you. So I have good news for you. We can make an impact with movement and lifestyle shifts. By engaging slow and fast twitch muscle fibers, we can train the pelvic floor just like every other muscle group. Movement is truly medicine. We can absolutely regain and reclaim our power no matter what stage of life we are in. Even as we age, we've seen evidence and research pointing toward strengthening of muscles no matter the age. It's never too late to start. We can always strengthen our muscles. Okay. And we need to start with actually accessing our pelvic floor. And first, we need to become aware that we need to do it, aware of where it is, and then we need to engage it. So I'm going to show you how now. And we are going to do another breathing exercise that really builds on what Dr. Manon shared. It will also impact your parasympathetic nervous system, lowering your stress levels and helping you to become more calm and more to reduce that fight or flight and to reduce the cortisol and strengthen your pelvic floor at the same time. I do want to point out before we begin that you will want to find a comfortable position, either in a chair, sitting down with your feet on the ground, or lying down on the ground on your back with your feet also bent, or your feet on the ground, knees bent, and maybe even something under your knees for support. And again, before we begin, I also want to just share a little bit about the intra-abdominal pressure and the core itself. So a little bit of education so that it will better help you to tap into your pelvic floor. So you can imagine our core like a canister, like a sparkling water can, let's say. So your diaphragm is at the top, your pelvic floor is at the bottom, and the sides are your rib cage and your abdominal muscles, your erector muscles of your spine. And as we breathe all the time, your diaphragm is responding to that breath. So as you breathe in and inhale, the core sides and the top and the bottom move away from each other. As we inhale, as we exhale, they move towards each other all the time, not even trying. So we're going to tap into that natural process today, and we're going to ask our pelvic floor to relax on the inhale. And we're going to start there. We're just try to relax and feel that relaxation distributed throughout our core, throughout that canister. And then on the exhale, I will ask you to pull the pelvic floor up eventually, but first we're just going to tap into that relaxation. We're going to place our hands on our belly, just above our belly button, or like at our belly button, one hand at your belly button and one hand right above it. And I invite you to close your eyes if that helps, because you can just listen to my voice and my cues. You no need to watch me. And on the inhale, we're going to feel our belly press into our hands. We're often taught to suck in our bellies on an inhale, and that doesn't physiologically really work. So what we want to do is really relax and feel that breath come into our bellies and feel that belly press into our hands as we inhale. So let's take a nice deep inhale through your nose if you can. And feel that diaphragm expand. Feel the pelvic floor relax, your diaphragm relax, the sides of your core relax, filling that body with breath. Exhale naturally. Again, inhale. Feel the pelvic floor move down. Maybe you can feel that. Tap into the diaphragm moving up, and exhale naturally. Again, inhale. Relax everything that you can access. Fill the belly up. Feel all those sides moving away from each other. Exhale naturally. A few more times just like that. Inhale. Feel the relaxation. Feel the belly. Feel the belly press into your hands. No need to contract anything here. Again, nice inhale. Feel everything move away from each other. Feel that pelvic floor drop. Ease or coax it into relaxation with your breath. Inhale. Maybe you can't feel it. It's okay. It takes a little bit of time. Just stay with me here. One more nice big inhale. Feel everything move away from each other. Relax, relax, and exhale. Okay, this time after the inhale, nice big inhale. Relax, relax, relax. This time on the exhale, try to coax your pelvic floor up toward your belly button. So you're initiating a contraction at the bottom of your canister, at the bottom of your core. Inhale, relax everything. Everything moves away from each other. Exhale, pelvic floor reaches up toward your belly button like an elevator. Slow pressure if you can. Inhale. Everything moves away from each other. This time on your exhale, I want you to think about pulling a tissue out of a box with your vagina. Scooping that tissue out of the box, pulling the pelvic floor up toward your belly button. Inhale. Nice big inhale. Fill the belly with breath. Relax. Everything moves away from each other. Feel everything. Feel that wide open space. Exhale. Pull your pelvic floor up. Think about pulling a tissue out of the box with your anus, with your vagina. Pull, pull, pull. Contract up toward your belly button like an elevator. 2 more times. Inhale. Relax. Everything moves away from each other. Now exhale. Pull up that pelvic floor like an elevator. Pull, pull, pull. Contract, contract, contract. All the breath moves out of your body. Inhale. One more nice big inhale. Relax. Fill that space. Fill the entire space with breath. Relax. And exhale. Contract your pelvic floor. Squeeze your anus. Squeeze your vagina. Squeeze, squeeze, squeeze. And relax. That is called the connection breath. And that is a very powerful tool that you can use everywhere, anywhere, all day long. I've done it in the car, in traffic, while sitting on the phone in a phone conversation, while lying in bed, while after a workout. It's a great way to reset your nervous system. And as you learn that, and as you become really comfortable with that, you can even pair it with strength training exercises. There are other exercises that build upon that strengthen the pelvic floor. And in my practice, I implement at least a 6-week training program to include pelvic strengthening exercises, but it's always starting with that exercise, always starting with the connection breath, because we need to know what we're trying to work on and become aware of those muscles before we can actually engage them and strengthen them. So I hope you enjoyed that. And as Dr. Manon said, it's super, super powerful to pair those two, the sacral chakra clearing with the connection breath, and really get all of those chakras cleared, the sacral chakra engaged, and then strengthen that pelvic floor within that same session. And yeah, great tools for your toolkit.
Amazing. They really do seem to go really well together doing the combination, because they can work on their body, mind, and all together in a session, be really, really powerful. I love that. And the things that we're both talking about, but I just want women to realize that a lot of these issues never stop completely. Like there's no like little period of menopause and then you're done. Women into their 60s, 70s still need to a lot of times still practice this and still get the benefit of it no matter what their age. So I did want to put that in there.
Definitely. Yeah. Menopause will last. It's not just a transition. It will be the state that we're in, the stage that we're in throughout our lives. And as we talked about before, you can strengthen at any age. Our muscles will respond when asked to strengthen at any age.
Yes. Yes, indeed. So even though we lose estrogen, we gain, there's so many things that we gain, and we focus on that. And, I think a lot of the medical profession don't realize that there are so many ways of, I wouldn't even say compensating, but all the other parts of our body, our glands, our muscles, all can be trained and work without estrogen. And there are also ways of increasing estrogen without even being on HRT. So there are just so many options that a lot of women aren't aware of. And I'm glad that we're starting to explore some things that they can do in a positive way that aren't medically oriented. This isn't something you have to go and buy some medication to do. It's things you can do for yourself, self-healing.
Absolutely. We have the power.
We have the power. All right. So is there anything else we need to say, finish at the end here, say goodbye to everyone? We're so glad that you were able to participate today. And as Terry and I both mentioned, how to connect with us will be in the description so that you can take advantage of the special offers and also get in touch with us should you need to.
Definitely. Yes.
Right.
We look forward to hearing from you. And it's been a pleasure spending time with you, Dr. Manon, and presenting this valuable information.
All right. Have a wonderful day.